Hi there, I'm Sean Dillman. In this video, I'll be giving you a status update with respect to my collapsed lung 1 year after I was in the hospital to have surgery. If you haven't already, please be sure to check out the original video that I made about my collapsed lung the day that I got home from the hospital. If you'd like to see something more positive that's happened in my life since I suffered a collapsed lung, please check out my surprise marriage proposal video. The purpose of this video is to share my experience over the past year since suffering a collapsed lung and having a corrective surgery, a VATS, a video-assisted thoracoscopic surgery to achieve a pleural effusion. If you're watching this video and dealing with a collapsed lung, whether spontaneous or not, you'll likely want to know about things like scars, pain management, recovery time, and lasting effects. I'll talk about each one of these subjects one by one. The first thing that I'll talk about is the scars that I have from the surgery. These are some photos that I took after getting home from the hospital. Although I'm smiling in some of them, I actually had quite a bit of pain for a few weeks and I was just putting on a brave face. As you can see, there are 4 incision sites and the lowest one is the largest. I think that is the cut where my chest tube was installed. As far as I know, the doctors used the other 3 sites for surgical tools and a camera. It may be difficult to see from the photos, but I developed a bit of a bumpy rash around my surgery site. In comparison, the skin on my non-surgery side was smooth and normal. As I recall, the rash wasn't painful and it only lasted a few weeks after the surgery. As far as the bandages go, I left them on for about a week or so, and I didn't take full showers or baths until I took them off completely. Instead of showering or bathing, I just washed in the sink to make sure that I didn't get my bandages too wet, and then I dried off using a hairdryer at the lowest setting. After I took the bandages off, I had a better look at the cuts and the stitches. The stitches that were used dissolved on their own, and I didn't have to go to a doctor or hospital to have them removed. I tried to avoid cleaning the cuts or putting water on them until they healed up a bit more. Another thing that I'll point out here is that I was advised by a nurse to put vitamin E oil on my cuts to help reduce the appearance of scarring and make them heal faster. I bought a small bottle like this, which was about 1 fluidic ounce or 30 milliliters. If you're interested in learning more about this product, please see my Amazon link in the video description below. I applied a small amount to each cut every morning when I woke up and every evening before I went to bed. I basically used the oil for a month or so until the bottle was empty. I'm not sure if it helped or not, but I hope that it did, and at very least it made me feel like I was taking action and doing something to help with the healing process. The last thing that I'll mention is that I noticed a strange dent or depression on the side of my body where the surgery was done. You can see it fairly clearly in this photo, particularly when you compare it to the other side of my body. I was a bit worried about this and I was afraid that it would stay that way, but it eventually went away and everything went back to normal. With respect to pain management, as I discussed in my original video, having a collapsed lung is painful. When I was at the hospital, I took some pictures and tried to look on the bright side, and I even made myself a little standing workstation so that I could stay busy and keep myself occupied with my laptop. However, the reality is that it hurts to have a chest tube in and it hurts to have surgery. When I was in the hospital, these leg wraps were put on me after the surgery to ensure good blood circulation in my legs and to ensure that I didn't develop an embolism. This little device collected the blood coming out of my chest tube from the surgery site. It basically went everywhere with me until I was able to have my chest tube taken out a few days after the surgery. I tried to make the best out of my stay by making my bed each morning, being grateful for the hospital food, and making myself mixed drinks of ginger ale and fruit juice. After my surgery, I basically stayed home for a week or 2 and barely went outside. Although my lungs felt fine and I didn't experience any of the sensations that I experienced when I suffered my collapsed lung, I did have a few weeks of pain related to the surgery itself. Basically, everything on my right side felt tender and sensitive around the cuts, and many kinds of movements hurt. This included getting in and out of bed, coughing, sneezing, and any other kinds of big or fast motions. I only started to go out into the public when I was suffering less pain. The last thing that I'll mention is that aside from the vitamin E oil that I used, I didn't use anything else to help me recover. Even though I was feeling pain, I didn't feel like I needed to take any medication, and I was confident that there would be less pain day by day, which proved to be the case. When it comes to recovery time, it took me about 2 or 3 months to feel entirely back to normal. Little by little, I went for walks outside to get myself moving again. The first few days, I could only go for 5-minute walks, but I slowly worked up to 10 minutes, and then 20, and then a half hour, and so on. Within about 2 weeks, I still had some pain around my cuts, but I felt like I could walk as much as I wanted. About 5 weeks after my surgery, I had a follow-up telephone call with the doctor who performed the procedure. He asked me how everything was going since the surgery, and we chatted for about 10 minutes. I told him that I was feeling good and ready to get back to normal, and he cleared me to start going back to the gym, though he warned me to take it easy and go slowly. A few weeks later, I started going back to the gym, and I slowly worked myself up to my usual routine of running and weightlifting. As far as lasting effects go, I don't really have any. I do have my scars, and I don't think that they're going to reduce much in appearance, but I don't really notice them, and there isn't any sensation on or around them. The doctor did tell me that I should now never go scuba diving or go into outer space, but I didn't really plan to do those things anyways. Since the procedure, I've taken many flights, including round trips from North America to Europe. When I was in Europe, I spent entire days walking, touring, and sightseeing, and I never had any issues. And aside from feeling like I didn't have enough legroom on the plane, there were no problems with flying. Okay, so before I wrap up, if you liked this video, please be sure to give it a like, comment, and subscribe to my YouTube channel. If you haven't already, please be sure to check out my original video in which I talk about having a collapsed lung. An amazing community has developed there through the posts, and I'm grateful that there are so many people who are commenting, sharing their experiences, and supporting one another. I want to say thank you so much to all of these people. I wish them and you all the best. So with that, there you have it. That's my status update 1 year after suffering a collapsed lung and having a corrective surgery.